Okay, so we're going to talk about medial elbow kinesio taping, and that is to try and correct the valgus, give the medial elbow some stability and offload the ulnar nerve. This has been coined the venous. So we don't want to do it in a closed pack position because we can't affect the elbow joint itself. So you want to do it in a loose pack position. And you're going to need 3 pieces of kinesio tape. So essentially we're going to create collateral ligaments on the medial elbow and trying to close that medial elbow in. So what we want to do is pop you up, you want to relocate the olecranon, and you want to twist in, keeping it in a loose pack, which is the hard bit, and then you want a kinesio tape and as much tension as you can get because this is a joint correction. Good, and then no tension at the top. Rub it in. Now essentially you just want to do that exact same move again, but more in a more medial, so you can overlap on the two. So we're shortening the length of the nerve and reducing the corner that it goes round. So we're shortening the length of the nerve by relocating the olecranon back into its place and then closing the valgus. So we do that in more of a loose pack and then pull the tape as hard as we can get. Now it would be useful to lift up at that stage. Now finally the fun bit. You might find with your ulnar nerve patients that anconeus is tight, and this bit helps to stretch anconeus. So anconeus is at the back of the elbow and it assists triceps, but it also pulls the elbow medially. So we're trying to pull them, it pulls the elbow laterally. We're trying to pull the elbow medially. So you want to do is just bend the elbow. We want to form your venous. So you're going to put the tape down with no tension, and basically what you're trying to do is to cup the tape around the olecranon. Make sure that it's all nice and formed, and then we have our venous.